I want to thank you for the opportunity to be with you this morning. It is a privilege to participate in your sacred work. The presentation I'm about ready to run through is largely anecdotal. There are far too many slides. We are going to divide the presentation in two. First, an illustration of how we profess our faith in our work. The second part, much shorter, we'll talk briefly about health reform. This presentation can be distilled to its essence in the following simple statement. There is no fundamental incompatibility between the profession of our Roman Catholic faith and temporal success. Again, there's no fundamental incompatibility between the profession of our Roman Catholic faith and temporal success. That should be self-evident. However, in this day and age, it doesn't seem to be. I talked yesterday in our panel discussion about how important it is in your dealings with healthcare executives to make, if you will, a business-like pitch to them if you intend to try and persuade them to work with you. Unfortunately, I hesitate to criticize my colleagues because having sat in their chairs for many years, I understand the dilemmas they have to contend with. Unfortunately, temporal concerns preoccupy them probably far more than they wish or would prefer. And so this presentation is designed to help you address with them that particular issue. They will, to a great extent, even in Catholic healthcare, I regret to say, tend to think that there is a fundamental incompatibility between profession of our faith and temporal success. That's simply not the case, and I hope with these anecdotes I'll be able to persuade you. Here's the title of the presentation. It's been adapted slightly. And notice, for those of you who have seen this presentation before, that we've changed our name. We are now the Franciscan Alliance, and I'll talk about that a little bit later. I don't often agree with Father Brian Hare. I'm not sure how many of you know him. I presume many of you do. If you don't, there is a website dedicated to his, well, perhaps his misfortunes. But in this particular case, I think he got it right. One seeks to influence, shape, direct, heal, elevate, and enrich a complex industrial democracy. It can't be done simply by the integrity of individual witness. It's done by institutions that lay hands on life at the critical points where people are born and die, where they learn and teach, and where they are cured and healed. I think he got it exactly right. We are not triumphalists. We are not pious. We simply engage the culture where we find it, and that's basically what I'm going to suggest to you this morning. Philip Gray, I think, got it right in identifying a Catholic institution through profession of faith, sacraments, and ecclesiastical governance. What makes an institution Catholic, of course, are Catholics themselves, who are united through all three bonds of unity, are a light visible to all, and do their best to live according to the principles of their faith. This is our religious order, the Sisters of St. Francis of Perpetual Adoration. Their headquarters are in Olpe in Germany, not far from Cologne. I had the privilege of going there about a week ago to spend time with the sisters. I'm getting a little bit of feedback here. I'm probably standing too close to a speaker. Had the privilege of spending time with the sisters about a week ago in their mother house in Germany. They were founded in 1863, fled to the United States during Bismarck's Culture Kampf in the 1870s, when summoned by local parish priests to found a healthcare ministry in the United States. Until that point, they'd been largely involved in teaching. Note the religious habit. This order is divided into three distinct provinces. There are actually four, but three of them are distinct. Two of them wear the religious habit, one does not. The two that wear the religious habit and emphasize community life are attracting more and more sisters to the order. The one that does not wear a religious habit and does not emphasize community life has not had a new sister in almost 30 years. Here's how our organization reports. We are a papal congregation reporting through one of the sacred congregations in Rome. And our direct ministerial sponsor, our member, is, as I mentioned earlier, the Sisters of St. Francis of Perpetual Adoration in Mishawaka, Indiana, not far from South Bend. The healthcare ministry, as I indicated, began in 1875 when Bismarck's culture camp made it impossible for the sisters to practice their religious faith in Germany. In 1974, we became a health system, and we've got approximately 16,000 employees. Here is our system depicted on a map. To the left is Illinois, where we have 2 hospitals. The middle is Indiana, where we have 13 hospital campuses. And here we are up in Michigan. We are beginning to expand into Michigan. We are beginning to establish facilities there. And so we are growing. Here's an organization chart which is intended to depict nothing other than the fact that we also happen to own a construction company, an insurance company, and an information services company. So we are not a one-dimensional organization in that sense. We have a fairly traditional healthcare organization. Here's the temporal success. I'm going to try to get away from this echo if I can. The organization is growing. We are roughly $2.3 billion in revenues annually, with an operating income of approximately 5.4%. As you can see, that's increasing. Our days of cash on hand are about 312, which is relatively high. And our debt to capitalization ratio is actually declining to about 38%. I'm happy to report. We are a AA rated organization through Fitch and Moody's, the bond rating houses. AA is just about the highest rating in healthcare. There are some AAA organizations out there, but they tend to be fairly small organizations, and the definite trend is away from AAA ratings. We are also, and ironically, among the leaders nationwide in the amount of charity we do and the percentage of our care and community benefits as a percentage of our net revenue. Those would seem to many people, particularly in the healthcare field, to be incompatible. How can it be that you're so financially healthy and yet you devote increasing percentages of your net revenues to the care of the poor and to social accountability programs? Now, the answer, as I suppose many of you understand it, is God will not be outdone in His generosity. And so, in fact, the more we do, the better off we are. And that seems to be the experience that we've had, at least throughout my tenure. We wonder sometimes how it can be that we have a large hole in the bottom of the boat through which all this money is flowing on a regular basis. But somehow we remain afloat. So the only answer, as far as I can tell, is God Himself will not be outdone in His generosity. Here's the organization part of the organization that I'm responsible for. We are divided into 4 regions: North, South, West, and Central. This particular region includes 5 hospital campuses. That hospital campus at the top is a for-profit joint venture, physician-owned facility that is Catholic in every sense of the word, and everything I'm about ready to say about the hospitals I'm responsible for applies equally to Franciscan Physicians Hospital. So it's a fairly unusual situation. We're not sure how much longer it's going to stay that way, but as of right now, it is a for-profit joint venture physician-owned hospital with the Sisters of St. Francis and operated as a Catholic facility. The Northern Indiana region is located in the Diocese of Gary, and our ordinary is Bishop Dale Melchick, who came originally from the Detroit area. There may be some folks here who know him. The catchment area, as you can see, includes parts of Illinois, Indiana, and Michigan, with a total population of a little bit less than 1 million people. Most of that taken up in the Chicago area. We do, in fact, have offices in the city of Chicago. So that's how broad this region is. And here's a depiction of it in highlight. This is essentially Chicago here, Illinois. Here's Indiana, and here again is Michigan. We've got, as you can see, we've got an office there in the northern part of Michigan. We've got about 40, listed on this map are about 45 facilities, 44, 45. They're actually closer to about 47, 48. We are regularly opening and closing them, and so that accounts for the fact that the numbers fluctuate. Here's just a brief depiction of the types of facilities they are. They include occupational health facilities, physician offices, health clubs, etc. The area that we're responsible for includes urban industrial zone. It's the Rust Belt in every sense of the term. Gary, as you may know, is the home of many large steel mills. And so these photographs were taken literally from that part of the area we serve. Rural areas in Crown Point, farmlands. Crown Point may be familiar to you, some of you, because among other things, it's the jail that John Dillinger broke out of with a piece of soap he fashioned out of a gun, I should say, he fashioned out of a bar of soap. So that's one of the towns that we're responsible for. And here's Michigan City, which is a recreational lakefront. This is what the northern Indiana region looks like in terms of its statistics. A large number of emergency visits, 40,000 admissions, 3,000 births. And that notation at the bottom of the screen indicates that there are 205 physicians. We have just announced that we're buying a very large clinic in our area. And with that and some other changes, we're expecting in 2011 we will probably have 300 employed physicians by the time the year is over. Here's our payer mix, mostly Medicare, as you can see, 44%. Medicaid plus self-pay, over 20%. The rest of it broken up among managed care and commercial. Commercial, of course, is going away very, very quickly. Our major service lines include all the major service lines you might expect, from occupational health through rehabilitation, through cardiovascular services. Any of you who are familiar with northern Indiana may know that there's a hospital doing open heart surgery on virtually every corner. So even the smallest hospitals in northwest Indiana do open heart surgery. It's really remarkable. And here again is the array of our facilities, which, as you can see, include renal dialysis, indigent clinics, outpatient surgery centers, lots of physician offices, etc. From a quality standpoint, we do okay. I noticed when I was coming in here that this hospital is either a current or a former top 100, which is a very prestigious recognition. Hospitals in our system have likewise won that recognition, and our local hospitals, which are just going through our accreditation survey, are doing very well. Our last hospital in the region was accredited earlier this week, or actually went through a survey earlier this week. We're also very popular with the community. Our hospitals are regularly voted best in the region. Here now is our mission. Every one of us is oriented to the mission. We are also evaluated on our mission. The back of that card reveals our Franciscan values with respect for life being first, because it is of paramount importance. Everybody, as I say, is oriented to this, and I include in that physicians, as well as employees, as well as volunteers and board members, etc. Our spiritual care services are really fairly legendary. We have a palliative care program, which I know brings a certain amount of concern to many people in the pro-life movement. We've learned that from a palliative care standpoint, if palliative care reports through the clinical areas, that it tends to do better. If it reports through the financial areas, you've got a problem. So our palliative care programs report through the clinical nursing program. Our spiritual companions for the sick are employed, folks who volunteer on their own time to be oriented for about 8 to 12 hours and visit patients on their own time. This is Sister Timothy, who on her own time goes out and visits patients in the facility who are not receiving visitors. It's a program that our spiritual care folks decided to develop because they recognized that there were some patients who weren't getting visitors. We have adopted a new program called No One Dies Alone. As you know, it's a travesty that anyone should come into a hospital and die alone because they have no visitors. Once again, our employees recognize this, set up a program, and we do in fact do our level best to make sure that somebody stays with a patient who's at risk of dying right through that moment. We do anointing of healers, memorial services for bereaved, retreats, daily mass. We have the Angelus is generally read over the PA system in the mornings. And our spiritual care companions, as you can see, are fairly active. We bless and dedicate everything. This is Father dedicating a coffee stand in one of our hospitals. And everybody's invited. We have a regional guide, which is a newspaper that comes out 3 days a week. Actually, it's now 5 days a week. I beg your pardon, it's 3 days a week. We're going to move to 5 days soon, which highlights events going on in each one of the hospitals and begins with a prayer and a reflection, spiritual reflection. We have chapels in all but one of our campuses. Our Franciscan Physicians Hospital does not have a chapel yet. The physicians are raising money to develop one now. We do adoration. There is regular adoration at our facilities. And as I indicated at the top of this presentation, our sponsoring congregation is the Religious Sisters of St. Francis of Perpetual Adoration. They do, in fact, participate in adoration. They expose the Blessed Sacrament 24 hours a day, 7 days a week, 300 and I think it's about 62 days a year. I think the Triduum is the only time when it isn't exposed. It is the engine room, as I like to call it, that is responsible for the graces that proceed from there to our facilities and to our ministry. We too are trying to imitate that. We do have a regular adoration in each of our chapels, although it hasn't yet reached the point where it is 24 hours. We have a fairly active Mass schedule at most of our hospitals. So we've tried to keep our chapels open and active, and they are central focuses of what we do in our facilities. Lots of visual reminders of our faith. To the upper left there, you can see that we also fly the papal flag, the flag of the Vatican, over each one of our facilities. We also feature a Spirit of St. Francis statue outside of every one of our facilities, a large bronze sculpture which we commission for each one of the facilities. And there's a story about this cross and crucifix. If we have time, maybe I'll get back into that. But lots of visual reminders of our faith in all of our facilities, which we think is critical to keeping a focus on the mission. Every one of our patient rooms has a cross of San Damiano in it. I was just in Assisi last week, as I think I mentioned, where I had the privilege of being able to actually pray before the statue, or the crucifix of San Damiano. It's a great privilege. Our patients love our crucifix of San Damiano in the rooms. They love them so much that we frequently find them pried off the walls. We did find initially that they didn't quite understand it, so we did produce this brochure explaining exactly what the significance of it is. And no doubt, we have had great luck and great fortune in that respect. We very rarely have someone who tells us that they don't want it in the room, in which event we won't remove it. But it is very popular with our patients. We run several clinics for the medically indigent in our area. And I want to emphasize these are clinics for the medically indigent. These are programs which are staffed by volunteer physicians. The purpose of the clinics is to care for folks who, let me back up here a little bit. I'm moving the wrong way. I don't know what happened here. Yeah, here we go, I'm sorry. The clinics are staffed by volunteer physicians, serve thousands of patients, and are very well regarded, very popular, and also strongly supported by fundraising efforts in the community. They do quite well. I called your attention to the Catherine McCauley Clinic. One of our hospitals was formerly sponsored by the Religious Sisters of Mercy, who are the sponsors here through the Trinity system. And when our partnership ended, they donated a substantial amount of money to get the Catherine McCauley Clinic going. So that's why we named it after their founders. We also offer a large number of abstinence teaching programs in our community. As you know, both the federal government and many state governments at various times have funded abstinence teaching programs, but with the controversy associated with them, I don't really think there's any kind of a controversy. With the controversy ginned up over these programs, both the federal government and the state government, at least in Indiana, have made it much more difficult to qualify for the funding. We made a decision about 10 years ago that we are going to sponsor these programs regardless of grant opportunities. And so we have full-time folks dedicated to providing abstinence education and other programs like that in our community. This is a billboard which advertises one of our programs. We do an extensive amount of teaching. This is one of the summaries, and Jerry Palazzolo is here. Did you ever meet with Angie early when you did meet with her, so you have a chance? Jerry was here at our place probably within the last couple weeks or so, and had a chance to meet one of our teachers. I put this slide up in front, and I apologize if people in the back may not be able to read it very well, but it lists kind of an old one of Angie's educational stats. That's 2005. Her report is still the same. I put this on because at that point, most of the work she was doing was with the public schools. The public schools are very much aware of what we're doing. It's a value-based educational process. And they were very concerned about the incursion of Planned Parenthood in our community. So the teachers would call us when they knew Planned Parenthood was coming and say, could you bring Angie in to do some abstinence teaching, because we know it's going to be a value-based program. So in fact, she teaches thousands of public school kids during the year, and there's not as much work being done for the Catholic schools. So it's an interesting program that the community has discovered and is supporting, and it's growing. It's growing in all of our areas. We have programs in Michigan City, in Crown Point, and in Hammond. So it's, as you can see from these stats, it's almost all public schools. One of our employees, this great lady here, who just retired, became very, and she's not a Catholic, became very concerned about the way sexual assault victims were being treated in Northwest Indiana. So she commended to us a model, which we now call the Center of Hope, under which we dedicate a specific part of our emergency department to the treatment of sexual assault victims, which we do completely in keeping and in accordance with the religious and ethical directives, by the way. Special sexual assault nurse examiner training. Our advocates also are trained and to be consistent with not only our mission, but with the religious and ethical directives. We set up the program under the auspices of the state prosecutor's office, actually the county prosecutor's office. And there was some thought that there would be some opposition from local police departments, local rape advocates, if you will, and from some folks in the community. In fact, the prosecutor embraced the program because it is so thorough and so professional. And he reports that, in fact, the number of successful prosecutions under this program have actually increased. So it's a program that's done completely in accordance with the religious and ethical directives. It's set aside from the emergency department. There is a female emergency physician who ministers to patients, several specially trained nurses who minister to them. They come in even on the evenings to take care of patients. And they've taken care of hundreds of sexual assault victims. Once again, then, this is one of those programs that can be done consistent with the religious and ethical directives and garner great support in the community. We also feature a St. Monica home for pregnant adolescents. This program has recently been expanded. The home was opened at a time when the last home for pregnant adolescents had closed in the Chicago area about 15, 16, 17 years ago. And we decided we would give it a try and see if we could make a go of it. Not only has it succeeded, but it is in fact expanding. And I think, Jerry, when you were there, they were talking about going through an inspection so they could start accepting patients into the new wane. Every year we, during Respect Life Month, we put roughly 4,000 crosses on the lawns of several of our hospitals. We then invite students from local schools to come in and participate with us. This is a joint effort of several of our hospitals. This is the South Campus of St. Margaret Health in Dyer, Indiana. And what's going by right in front here is US 30, which is an extremely busy road that links Illinois and Indiana. The engineering folks go out several days ahead of time, drill holes. The students are invited to come in and actually plant those crucifixes. Then there's a large ceremony presided over by the bishop, which is broadcast on our website. You can probably find it there if you're interested. The immediate past ceremony was quite a moving one, with a former resident from the St. Monica home coming in to talk about how it changed her life. And so it was really pretty remarkable. This is covered, this particular ceremony is covered both locally and in the national press. We make a habit of releasing, I should say, lots of balloons. We tend to always have a very beautiful day. The kids love watching the balloons being released. We assure the community that they are biodegradable balloons, so they won't cause any harm to wildlife. And it garners a great deal of publicity. Here's a photograph from a recent issue of America magazine, which picked up the coverage. We also emphasize our mission in our ads. This is one of our former ads, which emphasizes how we put spirituality into science and talks about our spiritual companions, the fact that we have priests on duty around the clock to care for them. It seems to be well received in the community. Masses for firefighters and police men and other rescue personnel. And then in our advertising, as you can see, we don't make any bones about wanting to recruit folks who understand what our mission is, and the ad seems to work. We have established what we call a Volunteer Advocates for Seniors organization, this being done in response to a problem I had in the Chicago area. I'm not sure how many of you come from the Chicago area, but there used to be a public guardian there by the name of Patrick Murphy. I ran into him once when we had a senior admitted from a nursing home who needed to have her feeding tube reinserted. He took the position, because he was her advocate, that she had pulled it out because she wanted to die. That led to a long fight between us in the courts. Unfortunately, the lady died before that fight was resolved. But when I came to Northwest Indiana, I was very concerned that we'd not get ourselves into that situation again. So one of our very enterprising executives, who's also an attorney, came up with the notion of volunteer advocates for seniors. It's a rather complex program which required him to get the approval of the local court system and the Indiana State Legislature to pass a law enabling us to train people to serve as volunteer advocates in a manner that would be consistent with our mission and with the religious and ethical directives. In other words, we don't withdraw people from treatment, including nutrition and hydration. We expected there to be some resistance to this. Because it was the first organized program of its kind in our area, the judges embraced it, as did all the attorneys, the guardianship attorneys. When he ended up taking it to the Indiana State Legislature, it was approved unanimously in committee and unanimously by both the legislature and the House, and signed immediately by the governor. That law has been amended several times so that we can continue to take into account changes in the way we administer the program. The volunteers are subjected to about 20 hours of training by us, which we're happy to provide. And the program is now spread to a number of areas of the state, and including a number of additional counties, and continues to be well received. We hope it will obviate the need for public guardians throughout the state of Indiana. And if it does, then we will have accomplished something. We regularly put out newspaper ads professing our values, our mission, etc., including especially during Respect Life Month. And we offer lots of retreats. We found that our patients and community members seem to appreciate the nourishment they get from our spiritual care services, so we offer lots of retreats. Believe it or not, we do May crownings. And we have kids from the neighborhood schools or employees' children who come in to have participate in the May crowning ceremony. Blessing of the hands is a regular feature. We will be doing that later on this month. All caregivers are invited to have their hands blessed. If you can't make it, somebody from Spiritual Care Services will come and visit you and apply the oil to your hands. They also do this we also emphasize the personal approach during Ash Wednesday. You cannot hide from our Spiritual Care Services people on Ash Wednesday. I've tried. And the reason I usually hide is because they make a special point of covering me with the greatest amount of ash as they possibly can, because they know not only that I'm the biggest public sinner, but also because I wander around all the hospitals and they want everybody to know that. So they will find you. You cannot hide from them. We make a point of searching throughout the communities we serve for stained glass windows that depict the Nativity, whether they're Catholic or non-Catholic. And if we can find one and the pastor agrees, we will photograph the window, give that pastor several hundred cards that he can use himself in gratitude for that, and then we circulate the Christmas card to folks in the region, and we turn the Christmas card into an ad. So this is our Christmas card on the left here, and this is our Christmas ad, which appears in all of our major newspapers on the right. Everything we do, obviously, turns on what the ethical and religious directives for Catholic healthcare facilities says. Every one of our employees, every one of our physicians, all of our volunteers get copies of the religious and ethical directives. We do, in fact, orient them to the religious and ethical directives, and they are expected to successfully complete computer-based training. All of our managed care contracts include a specific language concerning the religious and ethical directives. And as I mentioned earlier, we've just announced that we are buying a very large clinic in our community. The negotiation process with any physician, with any clinic, in any joint venture begins with the religious and ethical directives. It doesn't end with those. It begins with that. In many cases, we're not able to reach an accord with folks because they simply can't abide by the religious and ethical directives, and that's fine. We move on. In the case of this large physician clinic, we've been talking to them for many years, and they insisted to us that they wanted to understand how the ethical and religious directives would work for them before they would enter into a relationship with us. So we brought up physicians from other clinics in Indiana who are operating under the religious and ethical directives and sat them down and talked to them about how it would work. And after having been satisfied that our physicians were in fact abiding by them, agreed to be acquired by us. Here are a number of our challenges. Not any different, I know, from the challenges that you are facing, and many more besides that. Management of extrauterine pregnancy, nil-salpingotomies, and we're trying to figure out if there are any other techniques now through the NCVC which we can adopt, but so far it's basically self-injectomies. Withholding and withdrawing of nutrition and hydration. This statement came out prior to Pope John Paul II's statement. It's remarkably consistent with it, and it's reflective of what we learned both before and during the Shivo episode, which, if I'm not mistaken, was I think Terry Shivo died about 5 years ago this past week, if I'm not mistaken. I got caught with, I'm sorry, you're right, 6 years ago, I beg your pardon. I put a sign on the door of my office, which I changed every day, indicating how many days Terry Shivo had gone without food and water. I wanted everybody in the hospital to understand that. And eventually a reporter got wind of it and called me. And we had a conversation about it, and she ended up putting the story just below the masthead on in the Times. I can't tell you how fluorescent my hate mail was at that time. As some of you know, I'm sustained by my hate mail, and this was epic hate mail. But in fact, we were very comfortable with our position, and it has in fact been vindicated as time went on. We have a continuing problem, even though, as I indicated, we do expect folks to honor the religious and ethical directives, and we do tell them ahead of time that means no contraception, folks. We do in fact audit our physicians' compliance with the religious and ethical directives in that respect, and if we find that they're not being compliant, we counsel them, let them know that we're going to continue to audit. They do it a second time, we counsel them a second time. This couple violated it about 3 or 4 times, and so we ended up having to excuse them. Again, my hate mail reached a crescendo. A huge public debate about that. But in the final analysis, the local newspaper, circulation of over 100,000, printed an editorial in which they said, we may not agree with the hospital under these circumstances, but the hospital did in fact tell these folks what was expected of them, and in fact they have a right to do what they've done, and we have no criticisms to offer. So it essentially ended the controversy, and frankly this editorial was cited by that large clinic I mentioned as having persuaded them that we were folks they could trust. So they realized that we not only meant what we said, but said what we meant, and that in fact they could trust us. And that was the point at which apparently they decided that they would at some point enter into a relationship with us, because they knew that we would be transparent with them and that they could trust us. We had a large number of women who were coming to us years after their stillbirths and miscarriages and saying they wanted to know what we had done with the remains of their babies, the ones that these would be the babies that they hadn't decided to bury themselves. And of course we had buried the babies in consecrated ground in the local Catholic cemetery, but we felt it was important to begin to provide them with a place where they could go to reflect. And so several of our hospitals have set up separate areas within the local Catholic hospitals, which include statues that we acquired and ordered, and benches and places where they can reflect. As I say, this is being done in several of our local hospitals. We take time every All Souls Day to remember our foundresses, the sisters who came here from Germany to establish the hospital. Here we are blessing the gravestones of those brave sisters who came back in the late 1890s, believe it or not, to take care of our patients. Some of them expired in the great pneumonia, the great flu epidemic of 1918. So we try to maintain contact with our foundresses and keep in touch with them. Here is recent advertising from our Respect Life incident demonstration. In the context of health reform, we went out of our way to make it clear to our employees that this is our intranet site, that not only did we not support health reform as it was being proposed, but we urged them to contact their congressmen and representatives, their senators, and a large number of them did. Of course, it didn't work, so when the CHA indicated it was supportive of health reform, we took out this ad in every paper in the markets we serve, the Chicago Tribune, the Indianapolis Star, etc., announcing that we did not support healthcare reform legislation. We seriously considered whether we were going to put an ad in the Washington Post on Sunday of the vote, but it would have cost us $130,000, and we decided that we could probably devote that to the care of the poor rather than try to influence the blockheads in Congress. So I'm sorry to say the ad didn't make much of a difference, but that didn't dissuade us. We immediately wrote a letter to the Catholic Health Association, Sister Carol Kean, not only withdrawing, but demanding a refund of our dues. We're still waiting for the refund. Let's move to health reform, just briefly, if we can. I'm not sure how we're doing on time here. We're getting close to the end. I'm not a fan of health reform, but we're going to talk about it just briefly here because what health reform is going to bring us, and I think David is going to be talking about this later, is the world of the ACO. And I'm not quite sure how we're going to be able to deal with ACOs, but be that as it may, this is what health reform is going to mean to us. Focus on quality, not quantity, coordination and collaboration in care delivery, focus on patient-centered needs, and a focus on value, as you know. The Accountable Care Organization is the new lexicon. Unfortunately, there are no clear definitions of it, although the Federal Register will contain a document next week which will describe the ACO regulations, and it'll be interesting to see exactly what they say. They've talked about rolling out a pilot program, but at the same time, apparently they're going to impose ACOs on everyone else at the same time. As you know, if you've seen one ACO, you've seen one ACO. That caption below that poster reads, "Just because you're unique doesn't mean you're useful." Clinical integration is going to be critical in the context of health reform. Basically, is going to require us to be working far more efficiently and effectively with our physicians and with our patients, with other organizations, including employers, insurance companies, and government regulators. A part of working with government regulators is going to be the problem I'm going to have with this. Clinical integration is something we're working very hard on now, and it remains to be seen if we can accomplish it. But it basically means pulling everybody together and having us work as a team. So an accountable care organization is a collection of resources and providers that work collaboratively in an integrated manner across the care continuum. We're looking for greater effectiveness, greater efficiency, and transparency. ACOs are going to be designed to address a new equation of value arising from patient-centered care. Again, it's this question of value that I'm struggling with. ACOs are going to have to be accessible, affordable, accountable, and of course affable. We have to be as friendly as we can possibly be because patient satisfaction is going to be critical under this new scheme. Here are some of the performance-based clinical outcomes that you can expect to see in the context of the ACO regulations being promulgated. Lots of them, as you can see from this one in particular, lifestyle interventions concern me. There are other issues that tie into comparative effectiveness. That worries me quite a bit. So this is going to be a challenge for all of us. The initiatives that we're going to have to take are going to be directed at decreasing ER utilization, increasing generic drug use, prevention and lifestyle interventions to minimize complications, etc. It's going to be a challenge. It's something that we can do, we've been working on for many, many years. But the fact that the government is going to be playing a role is a source of great concern to me and to the folks in our system. Here are some of the behaviors that we're going to be particularly concerned about. Innovative partnerships, transparently accurate data, team-centeredness. All of these are very good, but in fact, my concern with health reform, and Dr. Condon of Michigan, I think summarized it quite well in his article on this point. My problems with health reform have to do with, and I think Father Morris referred to this last night as well, how it violates the principle of subsidiarity, how it violates the principle of solidarity, and how it, in many ways, leaves so much on the table that there's a question as to whether or not patient dignity, human dignity, can be preserved. This is a big concern for me. I know it's a big concern for all of you. I am not quite a lonely voice crying in the wilderness within our system, but I'm in a definite minority. Many of my peers within our own system think that healthcare reform can succeed and in fact will provide the kinds of protections to patients that I'm skeptical about. But we'll see, is all I can say. Right now, I have too many concerns about it to rest easy, and we will see what happens as healthcare reform begins to roll out. Here's a little depiction of my own cynicism. A short trip from riding the waves of change to being torn apart by the jaws of defeat. It's never too late to turn over a new leaf unless you're really, really old and close to the end. And yeah, it's probably too late. And then, when the winds of change blow hard enough, the most trivial things can be turned into deadly projectiles. Thank you, folks. Appreciate it.